Levels of measurement. In research and statistics, variables are measured at different levels, each with distinct characteristics that determine what mathematical operations are meaningful. The nominal level represents the simplest scale, categories with no inherent order and no numeric value. Examples include gender, blood type, or marital status. Each label is distinct, but no category ranks above another. The ordinal level introduces rank order. Categories can be arranged in a sequence, e.g., first, second, third, but the intervals between ranks are not necessarily equal. Common examples are a pain scale, mild, moderate, severe, or Likert scale responses, strongly disagree to strongly agree. Moving to richer scales, the interval level has equal intervals between consecutive values, allowing meaningful addition and subtraction, but lacks a true 0 point. Temperature in degrees Celsius or Fahrenheit and IQ scores are classic examples. The difference between 20 and 30 is the same as between 30 and 40, yet 0 does not mean no temperature or no intelligence. Finally, the ratio level possesses both equal intervals and a meaningful true 0, enabling all arithmetic operations, including multiplication and division. Weight, height, heart rate, and number of falls are ratio variables. 0 truly means absence of the attribute, so we can say someone weighing 80 kilograms is twice as heavy as someone weighing 40 kilograms. In short, nominal has no order, ordinal has order but unequal intervals. Interval and ratio both have equal intervals, with ratio distinguished by a true 0. Type 1 and Type 2 errors. In hypothesis testing, two types of errors can occur when making decisions about the null hypothesis. A Type 1 error, alpha, happens when a researcher rejects a null hypothesis that is actually true, in other words, a false positive. The consequence is concluding that an intervention works when in reality it does not. In nursing and healthcare, Type 1 errors are considered more serious because they can lead to implementing ineffective or even harmful treatments, thereby exposing patients to unnecessary risks. A Type 2 error, beta, occurs when a researcher fails to reject a null hypothesis that is actually false, a false negative. Here, the consequence is missing an effective intervention, which means patients may be denied a beneficial treatment. While both errors matter, the stakes differ. Type 1 errors risk actively causing harm, whereas Type 2 errors risk missing an opportunity to help. Understanding these errors helps researchers and clinicians balance the trade-offs in evidence-based practice. Measures of central tendency. In descriptive statistics, measures of central tendency help us summarize a dataset by identifying its typical or central value. The mode is the most frequently occurring score in a distribution. It is the only measure that can be used with nominal data, e.g., most common blood type or eye color, but it can also be reported for any distribution regardless of shape. The median is the middle value, the 50th percentile, that splits a distribution into two equal halves. It is the preferred measure for skewed distributions, such as income or hospital length of stay, because it is not pulled toward extreme scores. The mean is the arithmetic average, calculated by summing all values and dividing by the number of observations. The mean is best suited for symmetric distributions and interval or ratio data, e.g., temperature, weight, blood pressure, where equal intervals allow meaningful averaging. Choosing the appropriate measure depends on both the level of measurement and the shape of the distribution. Measures of variability. While measures of central tendency tell us where the center of a distribution lies, measures of variability tell us how spread out or dispersed the scores are. The simplest measure is the range, calculated by subtracting the lowest value from the highest value. Although easy to compute, the range only considers the two extreme scores and can be misleading when outliers are present. A more sophisticated and stable measure is the standard deviation, which quantifies the average amount that each score deviates from the mean. In essence, the standard deviation captures the typical distance between individual data points and the center of the distribution. A small standard deviation indicates scores cluster tightly around the mean, while a large standard deviation signals wide dispersion. Together, the range provides a quick snapshot of spread, and the standard deviation offers a precise, comprehensive summary of variability, both essential for fully describing a dataset. Shape of distribution. A normal distribution is perfectly bell-shaped and symmetric, with the mean, median, and mode all equal at the center. In contrast, a positively skewed, or right-skewed, distribution features a long tail extending to the right, while the bulk of the data clusters on the left. This pulls the mean toward the tail, so the relationship becomes mean-median mode, with the tail pointing to the positive side. Conversely, a negatively skewed, or left-skewed, distribution has a long tail stretching to the left, with most data concentrated on the right. Here the mean is dragged toward the left tail, giving the opposite order, mean, median, mode, and the tail points to the negative side. The t-test is a statistical tool used to compare the means of two groups, determining whether the observed difference between them is likely genuine or merely due to random fluctuation. Accompanying the t-test is the p-value, which quantifies the probability that the results, or more extreme ones, would occur if chance alone were at work. In other words, if the null hypothesis of no real difference were true. When the p-value falls below conventional thresholds, researchers reject the null hypothesis and declare the result statistically significant. The most common benchmark is p less than 0.05, meaning there is less than a 5% probability that the difference arose by chance. We can be 95% confident the difference is real. A stricter threshold, p less than 0.01, indicates less than a 1% probability due to chance, offering 99% confidence, often labeled as highly significant. An even stronger standard, p less than 0.001, puts the chance probability below 0.1%, giving 99.9% confidence and earning the description very highly significant. In essence, the lower the p-value, the stronger the evidence against the null hypothesis, and the more certain we can be that the two groups truly differ. In qualitative research, different traditions guide how we explore human experiences. Phenomenology focuses on lived experience and the meaning of a phenomenon, using in-depth interviews and a technique called bracketing, setting aside preconceptions, to see the experience fresh. Within this tradition, descriptive phenomenology specifically emphasizes bracketing as a core practice. Grounded theory aims to develop theory directly from data, relying on the constant comparative method to build concepts upward from participant accounts. Ethnography, in contrast, turns its lens on the culture of a group, immersing the researcher through fieldwork and participant observation to understand shared beliefs, practices, and rituals from an insider's perspective. Each design offers a distinct path to rich, contextual understanding, yet all share a commitment to exploring meaning as it arises naturally from human experience. Sampling in qualitative research. In qualitative research, sampling is guided by the goal of depth rather than breadth. Purposive sampling is the most common strategy, involving the deliberate selection of information-rich participants who can best illuminate the research question. When access to such participants is difficult, researchers often turn to snowball sampling, where initial participants recruit others from their networks, gradually expanding the sample like a rolling snowball. Convenience sampling, choosing participants simply because they are available, is less common in rigorous qualitative studies, as it may compromise richness of data. Regardless of the method used, sample size is not fixed in advance. Instead, researchers continue collecting data until saturation is reached, the point at which no new information or insights emerge from additional participants. An adequate sample size is achieved when redundancy occurs, meaning the researcher has heard the same themes repeatedly and can confidently anticipate no novel findings. For focus groups, a common qualitative technique, each group typically includes 5 to 10 participants, a size small enough to allow everyone a voice yet large enough to generate diverse perspectives and group interaction. In qualitative research, trustworthiness is the gold standard for rigor, replacing traditional concepts like validity and reliability. It rests on 4 key criteria, each supported by specific techniques. Credibility concerns the confidence we have in the truth of the findings, whether the researcher has accurately captured participants' realities. To build credibility, qualitative researchers use prolonged engagement, spending sufficient time in the field to understand the context, triangulation, cross-checking data from multiple sources, methods, or investigators, and member checking, returning findings to participants to verify accuracy. Transferability refers to the applicability of findings to other contexts or settings. Since qualitative studies often focus on specific cases, researchers enhance transferability by providing thick description, rich, detailed accounts of the context, participants, and processes, allowing readers to judge how well the findings might transfer elsewhere. Dependability addresses consistency over time. Would the study yield similar results if repeated under similar conditions? An audit trail, a transparent, step-by-step record of all research decisions, data collection, and analysis, enables others to track the researcher's processes and assess dependability. Confirmability ensures neutrality, meaning the findings are shaped by the participants and data, not by researcher bias. Key techniques include bracketing, setting aside preconceptions, as in descriptive phenomenology, reflexivity, ongoing self-awareness of how the researcher's background influences the study, and again the audit trail, which documents how interpretations were reached. Together, prolonged engagement, bracketing, triangulation, and maintaining an audit trail all serve a common purpose: to limit bias and strengthen the overall trustworthiness of qualitative research. When these strategies are woven into a study, readers gain confidence that the findings are credible, transferable, dependable, and confirmable.